That's no, it doesn't matter. I mean, how strong is it? Yeah, anywhere on there. I think just as long as people have room. Some people have printed remarks. The stage is open. I didn't do it. No.
I didn't notice there already. Do you just want this to SCA healthcare job? SCA healthcare is so
It's state council on there too, but healthcare is where the speakers from, so.
okay.
What's up, Scott? Yo.
You'll need a sound test at all?
Sure.
Test, test, 1, 2, 1, 2. Test, 1, 2.
Giving people a minute.
Yes. In fact, I think we want to start moving folks in.
You want me to?
Yeah, if you don't mind. Test, test, 1, 2, 1, 2. Test, 1, 2. Test, 1, 2. Cool.
I'm a shorty, so I'll sit closer to we gotta get our gun bill across. Stupidity. I know.
I was going to say short people should be
Want to sign? No, it's fine. Want to sign?
Hey,
I need to use the risers.
That's right. Much space.
It's fine, Tom. That's great, right?
yeah, have you done that?
Yeah,
I've never done it.
It'll be great.
it'll be fine.
It'll be great, it'll be great.
You'll be gonna do great. Yes, you're gonna do it. It's not that bad.
Yeah, yeah.
I'm not used to the bright lights though.
No problem for these, but that's good, right?
Good morning, everyone. I am Jamie Long, Democratic House Floor Leader, and I want to thank all our colleagues and community members for joining us here today. We are here because it has been 3 weeks since the federal government has shut down, and we want to be crystal clear on what the reason is. It is because Donald Trump and Republicans in Congress refuse to extend the premium tax credits, which are helping keep healthcare costs low for Minnesotans. We are in an affordability crisis in Minnesota right now. People are seeing their costs skyrocket across the board, and that's why it's unconscionable that this fall we are seeing up to 50% increases in healthcare premiums for Minnesotans. You know what would help that? Extending the premium tax credits that we have seen help keep healthcare costs low for Minnesotans for the last several years. And the cuts that we are seeing to these premium tax credits are coming on top of the attacks on Medicaid that came in the Donald Trump budget bill this past spring. We've heard the Republican leadership in our state defend these Medicaid cuts, saying, oh, those are only going to keep off people who are not eligible. Well, that is simply not true. We have 140,000 Minnesotans who are going to lose their health coverage because of these Medicaid cuts. And now we have 62,000 additional Minnesotans who are going to lose their health care coverage because of these increases in premiums. And this doesn't just affect those 200,000 people. Those folks are going to delay care because they can't afford it. They're going to end up in Dr. Mann's emergency room with more worse conditions than they would otherwise have. They're going to have uncompensated care that's passed back to the hospitals and the doctors. And what's that going to mean for the rest of us? It's going to mean sicker neighbors, and it's going to mean higher health care costs for the entire state and for every Minnesotan. So you might ask the question, well, why wouldn't we do this one simple thing of extending tax credits that we know we can afford that will keep health care costs down? And the answer is very simple. It is because we are seeing the largest wealth transfer in the history of the United States that was enacted in the Trump budget bill this past spring, where we are taking health care from those who can least afford it, and we are passing that money on to billionaires who least need it. So that's why we are here, to stand behind the Democrats in Congress who are fighting to make sure that we are bringing health care costs down for Minnesotans. So I'll pass it on to our next speaker.
Good morning, my name is Becky Cook. I learned that one of the fastest ways to jump to the front of the line in the ER is to come in nearly unable to breathe. On New Year's Day in 2019, I woke up with my tongue having slowly swelled overnight. By 6 a.m., my tongue was so big I couldn't close my mouth. When I got to the ER, my tongue and throat were too swollen to put the breathing tube in through my mouth, so they had to go through my nose while I was awake. It was horrific. I spent the next 24 hours in the ICU. Eventually, I would be diagnosed with hereditary angioedema type 3, a condition which causes parts of my body, my hands, my feet, my lips, my tongue, my throat, to swell at any time. Because of this, I have to use giant spreadsheets to map out and compare MNsure plans so that I understand what a worst-case scenario will cost for each plan. I have twins who are 18 years old, and my husband gets his health insurance through his work, but my kids and I have a U-Care plan through MNsure. In 2025, our premiums were $999.56 per month. Next year, for the same plan, our premiums will rise to $1,400.38 per month. That's almost $5,000 more per year just for the premiums. This doesn't include the higher deductible and out-of-pocket max costs. My daily medication has a sticker price of $46,000 per month. Not $4,600, $46,000. My rescue meds are between $1,000 and $2,000 per syringe, and I need to have 3 of them at all times. There have been times that I have gone without my rescue meds because a trip to the ER costs less for me than having to buy the rescue medication. I have worked as a part-time preschool administrative assistant for 9 years. My preschoolers and their families fill me with joy, but my health insurance premiums are getting dangerously close to the same amount of money that I take home each month. There's not an option to work full-time where I am. So to be eligible for employer-sponsored health insurance, I would be forced to change jobs entirely. My health insurance is not attached to my job, yet it could dictate what my job can be. And why? Because Republicans are choosing tax breaks for the rich over the lives of the rest of us. Republicans refuse to continue funding the enhanced premium tax credits that make health insurance more affordable. They are instead making insurance unaffordable for millions of families like mine. It's unconscionable. I'm grateful that the Democrats recognize the reality of the healthcare crisis we are in and are standing with us. Thank you.
Hi, my name is Gail Larson, and my job is personal care assistant. I'm here today as a member of SEIU Healthcare Minnesota and Iowa. Our union brings together nearly 50,000 healthcare workers across the state, caring for people in their home, nursing homes, and hospitals. We keep Minnesotans safe and healthy every day. But I am here today as a person who will lose my health care in just a few days. I can't afford what is being offered, and I can't find a path that will help me move me forward. For the last few weeks, in what spare time I do have for myself, I've been trying to chase down help and only finding confusion. But what I know is what I've heard is the cost for insurance for me would be in anywhere from $600 to $1,000 a month. I can't afford that. As someone who is a caregiver for multiple people in my home, how can I do my job without my health care insurance? How can I keep others healthy? Not having health care would, in my future, would change, if nothing changes, would mean no medication for me and no appointments. No medications for my diabetes, no medications for my pain, no appointments for my mental health therapy. I am not sure if I can survive and if I can be healthy. It means people that I care for will be in chaos. I am the sole person in my household who keeps everything together. And if I don't have health insurance and couldn't take care of myself, people wouldn't be cared for. Appointments wouldn't be made. People would end up in nursing homes, group homes, or foster care. And I could be homeless. We need action on this now. So many families are facing this crisis. To those who don't think this is a problem, I'd say, take a day and walk in my shoes. How is my family going to get the care that they need? Who is going to take care of my family? Who is going to take care of me? How has it come to this? While the rich get tax breaks, families like mine are lying awake at night, worried about what will happen to us. We need support from those in power. Listen to Minnesotans like me, lower our health care costs, and end the shutdown.
Hello, I'm Gary Werdish. I'm president of the Minnesota Farmers Union. We're a grassroots organization representing farmers and rural communities in Minnesota since 1918. You know, right now farmers are wrapping up their harvest or trying to finish their harvest throughout the state under very uncertain times. You know, we're looking at depressed prices for our commodities and raised prices for our inputs, all because of the president's love of tariffs. His love of tariffs has driven our what we're selling the product down. We're losing markets, primarily the China market and other markets, and raising the import costs up with the tariffs. It's affecting the prices of fertilizer, steel, aluminum, everything that comes in. You know, we're such a global economy now. We operate, you know, we work, whether it's machinery, like say a John Deere combine, for an example, is a lot of them parts are made overseas. So that's all affected in the tariff, reflects back on the price of that combine. Food, you know, we're talking high prices of food for the consumers. A lot of that tariffs has an effect on that too, in the cost not only to the farmers but the processors. It's increased those prices, so you know that's raising the price of food to the consumers too. But you get that, and now on top of that, now we're facing with a federal government shutdown, primarily over restoring the ACA health care subsidies. Farmers and independent businessmen, anybody that buys insurance on the individual marketplace is faced with a huge subsidy or a huge increase in their insurance costs. We have a few members that just recently, one member went in and before their insurance, just for a normal checkup, before their insurance policy lapsed, because they were questioning whether they're even going to keep their insurance. And luckily, through just a routine checkup, found a very serious issue, a cancer issue that they're able to take care of, and required a lot of surgeries, but the person's in recovery or doing quite well. And another member, the same situation, found, you know, that as their income was going up and down, one year they had insurance, the next year they didn't. And luckily for that person, found in a routine checkup, found a cancer and got treated, and that year they had insurance. Now both of those families are being faced with insurance premiums going up for 23 to 30% increase on their premiums, and they're looking at, can they afford to buy their insurance the next year? They're going to have to go back without insurance and take the risk again of not having health care insurance. That's what the individual farmer, anybody on the individual marketplace is facing right now. And Representative Long said it well. Anybody that's even in group insurance is going to be faced with higher premiums through their costs of insurance, and the employers are going to take up some of that, but some of that's going to be passed on to the employees as the rising cost of health care. So you got individuals on the individual marketplace like farmers now struggling just to make cash flows, just to make their loan payments. They're going to be faced with the decision, do I take my insurance premium? Do I drop it so I can make my payment to the bank so I can keep my farm, so I stay out of foreclosure? Or in some cases, I can see some individuals even, do I drop my insurance so I can put food on my table to feed my family? You know, you got those in leadership in D.C. are saying that this is not a now issue. This we can deal with this later. Those are not the ones that are being faced with the decision: can I afford to pay for my health insurance or not? They're going to have their insurance is going to be unaffected. They're going to have the insurance. They're not the ones that are be faced with the hard decision of paying for the health care insurance. So that's we're losing. It's time to get back to the table. You know, they say that's an issue that we can take up later. It's kind of like the restoring our trust in as the president's love of tariffs has really destroyed our trading relationships, our trust as a reliable trading partner. The same thing is falling back now in Congress. Is your word any good? They say that we'll take it up later. Are they going to take it up later? And if they take it up later, is the president just going to alter, through the stroke of a pen, get rid of it again? So this is a now issue. It's affecting every one of us, and thanks for allowing me to speak.
Good morning. My name is Lisa Lynch, and I want to share with everybody how Medicaid and Minnesota Care, our state and federally funded public insurance program, saved my life when I was diagnosed with stage 4 cancer. I live in Minneapolis. I'm a single mom. I'm a self-employed marketing strategist and a lifelong Girl Scout who believes in service, courage, and community. When I was diagnosed with stage 4 breast cancer in last January at age 49, I had to tell my 2 daughters that I had a 50% chance of living 6 years. My youngest, who was 14 at the time, asked me, "Will you be there for my high school graduation?" I told her yes. And when she asked about college, I looked her in the eye and I said yes again. That night, I made 3 goals: to save my life, figure out a plan for that, to create a stable environment for my girls, and to figure out how to survive financially. I got my first W-2 when I was 15, and I've been working ever since. But no matter how hard we work, no one should have to earn the right to health care. Everyone deserves access to care. When I was diagnosed and could no longer work, my income dropped to 0. I applied for Social Security disability and was covered through Medicaid. After 7 months, when my Social Security disability started, I moved to Minnesota Care. Then, for 1 month, I had to go on an ACA plan, and I was so grateful that the pre-existing condition protections were still in place. So I was able to move from one insurance to another and have access to care throughout the year. This year, I've been on Minnesota Care, and I will transition to Medicare in December. Through all these changes, I've had continuous coverage because programs like Medicaid, Minnesota Care, and the ACA work together the way they're supposed to. I received care at the University of Minnesota, go Gophers, my alma mater 2 times, a leading research institution, and I've had nearly 100 medical visits in the past year. And this is I came from a place where I rarely went to the doctor, right? So I find myself in this world of no choosing of my own, right? My targeted cancer therapeutic, Kisqali, costs thousands of dollars each month. Not to mention all of the scans and other appointments. Without these programs, I couldn't afford my care. The home I've lived in for 22 years would also be at risk. And by the way, the life-saving treatment I'm on wouldn't exist without NIH funding. Just a little plug for that too. Within 6 months of starting treatment, right before my 50th birthday, I am really happy to say I had no evidence of disease. It's basically a miracle. And I've stayed that way for a year. The truth about stage 4 breast cancer is it has this way of coming back. So medically, you are never considered cured. It's just something that I will be treated for the rest of my life and an uncertainty that I have to live with. If the proposed cuts to Medicaid and the ACA had been in place when I was diagnosed, I don't know what I would have done. I know if I lived in another state, my outcome would have been very different. So healthcare for me isn't a partisan issue, it's a human one. I'm asking our elected officials to end the shutdown and restore funding for Medicaid and the ACA because no one fighting for their life should have to fight for their coverage too. I want to say thank you to science. Thank you to Medicaid and Minnesota Care and the great state of Minnesota for always prioritizing public health. And thank you, God.
Good morning, everyone. Senator Elise Mann, Senate District 50. I feel like we are on a hamster wheel saying the same thing over and over again. We've heard the numbers. 200,000 Minnesotans will lose health care coverage. Another almost 90,000 will see their premiums spike up. Health care costs are going to increase for everyone as care becomes more critical and later in disease versus prevention as people forego care. People will lose their jobs, they will lose their homes. We are going to see an increase in poverty. But we've said this 100 times already. I don't know how many press conferences we can have where we share the devastation that the federal government is raining down on everyday working Americans, or how many personal stories you need to hear and we need to share to show what happens when you take away people's health care and their access to food and subsequently their homes. So I want to start off by naming that this is not politics as usual. This isn't just Republicans versus Democrats. This is authoritarianism, a government concerned with enriching themselves and impoverishing the people versus democracy, a society with checks and balances, and where everyone is treated as a worthy human being. We have to start saying that out loud, especially in the media, because this isn't new. This isn't unique to the United States. We have seen authoritarian governments and dictators take over many countries before us. And unfortunately, many of us are sitting back like this is business as usual, politics as usual, as our own country transforms into an authoritarian regime. And I will note that between 7 to 8 million people showed up to rally against this takeover, which is the largest public demonstration in United States history, and that didn't even make the front page of the newspaper this last week. So this government is banking on the fact that the media will underreport, because when you do report, the media gets attacked, and that's the game plan, along with impoverishing the population. They take our food, they take our health care, and that's exactly what that Republican congressional bill does. It also takes away people's opportunity for an education. This is happening right now, right here, as the government takes away access to student loans for university and for graduate schools. And they continue to try and defund public schools and universities. Because if you keep the population poor, it is much easier to squash any dissent, because people are worried about surviving and not fighting back. And if you keep people uneducated, it is much easier for state-run propaganda to disseminate false information. So while all this is happening, we are here begging for health care from the same government that just gave Argentina a $20 billion bailout, from the same government that is remodeling the White House and adding a ballroom, from the same government that just bought a $173 million airplane for the Secretary of Homeland Security because she needed her own plane. And we are here begging for health care, while everyday working Americans show up at press conferences like this week after week and committee hearing after committee hearing, asking for food and for health care. We have a federal government that is stealing from the people and enriching themselves. It is not a coincidence that the president's net worth has increased by billions of dollars in 9 months. No president in U.S. history has used his position of power to enrich himself as immensely as this president has, while we are here begging for health care. So we will keep sharing these stories about how people's lives will be ruined by the Republican congressional bill. But my question is, as long as they keep benefiting from being in the good graces of our new dictator, will they care? Because if they did, that bill never would have passed in the first place. And we wouldn't be standing in front of you today sharing devastating stories about how everyday working families and farmers and small business owners and people who are self-employed are going to no longer have access to health care or food in the richest country of the world. With that, any of us would be very happy to answer any questions.
I think we've heard about sort of the impact that the premium tax credits going away is going to have on sort of the people that are receiving those at the moment. Can anybody speak to the broader impact that that'll have on premiums as a whole, even for those that maybe aren't receiving those tax credits at the moment?
Sure. So when we take health care away from a large portion of the population, they will still receive health care in the emergency department, right? But instead of preventing an angioedema episode, from preventing diabetic ketoacidosis, from preventing an asthma attack, which can be done with medications at home, these people will end up in the emergency department getting care. They will end up in the ICU. They will end up intubated. And so the cost of health care is going to increase significantly across the board for everyone. And the first thing that's going to happen is your insurance company, through your employer, is going to increase their rates. And so everyone is going to be affected by this. On top of that, we are going to see hospitals close. Rural hospitals will close as we have another $262 million of uncompensated care set to go into effect because people don't have access to care, don't have health insurance. Hospitals were closed, ER wait times will increase. Every single person in America will be impacted by these incredibly selfish and harmful policy decisions.
Are those broader impacts showing up in open enrollments this year?
I mean, yes, right? You're hearing people who can't find insurance that they can afford. So that's already gone into effect. People have gotten their premiums in the mail. They know what they're going to have to pay. And so we absolutely, this is already going into effect.
I'll just add, you saw in the Republican budget bill that they pushed off most of the impact until after the 2026 election. And that's because they know how unpopular it is for people not to have health care. But the impact of the premium tax credits is happening right now. And so that's what you're seeing in the individual market as the premiums go up. And we're seeing that impact right now, which is why Democrats are standing strong in DC right now. But we know that there's a ticking time bomb for Medicaid coming in just a year or two. So we see both of these impacts coming, and all we're asking for is that we do what we can now to keep premiums down.
But right now, are you pointing people to like MNsure, or are you having conversations about you might draft, bill come next year if these, with these credits expiring?
Well, we are doing what we can at the state level.
Yeah.
We are trying to help, I know that MNsure and others are trying to help provide information about what options folks have, even if they're limited and even if their costs are going up. In the legislature, we introduced legislation last year called the Millionaires for Medicaid bill, which would try to do our small part in trying to help backfill some of these huge impacts. But let's be real, federal Medicaid is 1/6 of the state budget. There is no way that we're going to be able to fully backfill that. So we are not at the state level going to be able to fully soften the blow. We also, as Democrats and folks up here like the Farmers Union and SAIU have been fighting for better access to affordable health care in Minnesota. We worked hard on a bill that would let anybody buy into Minnesota Care to have an affordable option to make sure that folks would have good coverage, good health care access. We took big steps towards that, but as soon as President Trump was elected, there's no real point in going forward with that. It would require a federal waiver. And so we haven't been able to do some of the things at the state level that we would want to do because the federal government's standing in our way.
So I'm State Representative Kaliher. I'm the DFL co-chair of Commerce. The individual market falls under Commerce's purview. We will say that the briefing that we've gotten from Commissioner Arnold is that, and also meeting with our nonprofit healthcare insurers, that premiums are increasing double digit, and within those, depending on the plan, some are increasing up to 50%. I will just add additionally that we are asking that people continue to go through the MNsure website because it will help them navigate through, and we have people who will be able to help them because even if they cannot stay in their current plan, we encourage them to continue to still use MNsure. I will add one last thing that in addition to what Dr. Mann said is that our state is very unique. For example, in the city of St. Paul, all of our emergency services come from our fire departments. EMS comes out. When you call 911, it's EMS comes out. So not only is this an additional cost on health care for people, but this burden of the additional cost of emergency care is going to be falling on taxpayers in higher property taxes, in additional cost to them because they are bearing now the additional burden of the cost of emergency care when we send out an ambulance to address the needs of people. And so there are many ripple effects and costs of this to the people of Minnesota.
Just to return to something you were saying real quick, I wanted to ask a little bit about public options. You brought a second ago there. Is that something that you guys are still hoping to pursue next year? Could that help offset some of these impacts that we're talking about here today that we've been talking about the past couple of months? What could that look like?
Well, the struggles in the individual market predate what we're seeing with rolling back the premium tax credits. We've seen challenges in affordability in that market for some time. And, that's one of the reasons why we've had such a big coalition that's trying to get better access to affordable health care and letting people buy into Minnesota Care, which has been a Minnesota model that has succeeded in giving folks who can't afford other good health care coverage that option is one of those possibilities. And it's certainly something that I know many of us want to keep fighting for. As long as President Trump's in office, we don't see a path. All right. Thank you. Thank you, everyone.
Thank you.
Thank you.
Oh, thank you. You were kind of this. You were fantastic. Oh, yeah, thanks.
I was like,